As a researcher, I'm vaguely aware that there are these kind of data and they sort of exist somewhere. But to be honest, I have no idea how to access them. And I think what EMIF is helping to do is to make this data increasingly available. So to make the data findable, accessible and reusable. And we also add in some interoperability as well. So we come close to helping researchers make their data as fair as possible, the FAIR principles being data that is findable, accessible, interoperable and reusable. We help researchers do that. But we also help researchers see where the data is and put them in touch with the people who manage that data and bring the data together. I think we've made great advances. It's a work that's going to continue for a very long time. This is not a short-term project, but I think EMIF has probably advanced the field maybe even more than any other single project. And we've done so in two really important disease areas, Alzheimer's disease and metabolic disorders. It's important to think where the data comes from. The data comes from individuals, it comes from people. Whether those people are research participants in the cohort data, whether they're citizens and patients in the electronic health records data, the people who generate the data are individuals. And I think those people could very reasonably say, well, why are you using my data? What purpose is it being put to? And what's the value in using my data? And I think we have one sort of overarching answer to that and then lots of smaller answers. The overarching answer is we're trying to use data more effectively to make progress in important disease areas. We're trying to make progress that will result in better treatments for people in the future. Two areas that we've chosen are some of the two biggest unmet needs, metabolic disorders and Alzheimer's disease. As a patient myself, as a citizen, I recognise that I'm generating data, and as a research participant, which I also am in studies, I know that I'm generating data, and I do so willingly. What I want is for my data to be used responsibly, respectfully, and productively. I don't want my data to be sitting in a single computer of a single researcher who's maybe doing some great work, but he could do even more greater work if he didn't work by himself, but worked with her over there, and him over there. So I want my data to be used respectfully and properly, but I want it to be used maximally for the health of our populations. I think that's what most other people want too. So I think the institution IHD is doing a great deal to help the field of data management and people using data, bringing groups together, ensuring that we have trust between researchers and the individuals that generate the data, the patients, citizens, participants. And I think that in this act of bringing people together, it helps to, if not completely dissolve, begin to break down some of those walls between researchers and between the research community and the general public. It helps to reduce the siloization, if that's a word, the silos that sometimes exist in science.